Social inclusion is just finding ways of reaching the society to get the various services, specifically to the special groups, the vulnerable groups automatically, so at least they get access to the services that are needed, specifically in medical services.
As a county, if we compare before DESIP came, in 2014, in terms of family planning uptake, I think we have really have an increase in terms of uptake. And of course, even in terms of total fertility rate, in 2014, the KDHS, we were at 4.6%. And of course, in 2022, the report has it that we are at 3.6%. So it means in Homabay County, a woman will have 4 children. And before, in 2014, 5 children. So that one has an increase. And in terms of the CPR, the contraceptive prevalence rate for Homabay County, in 2014, it was 46.7%. But in 2022, it was 57%. So it means that one was a 10% increase. Yeah, and even in terms of teenage pregnancy, it was 33% in 2014, and in 2022, KDHS it was 2023.
Before the inception of DESIP as a program, the aspect of social inclusion was something that we really did not embrace, because it's actually a new thing that came in. We have seen, we've been seeing persons with disability coming to our facilities, but we really did not see that we needed to fully incorporate them in our service delivery. And one of the challenges was because we have different types of disabilities, and one of the commonest being persons who are having hearing impairment. And that needs a very special skill in terms of communication with them. And in the Ministry of Health, not every health worker is equipped with the knowledge on sign language, the Kenyan Sign Language. And that has brought a lot of challenge, especially when dealing with persons who are having hearing impairment. In terms of accessibility for the persons living with physical disability, again, our facilities were not constructed in a way that they automatically accommodated persons with physical disability. So you will find like a wheelchair user could not easily access the facility because there were no ramps, there were no rails, there were no disability toilets, or even disability-friendly coaches or infrastructure.
PS Kenya through the DESIP, they've done a lot of things to persons with disability. First and foremost, they've done the basic training of healthcare workers on issues disability. They've also ensured that we have the sign language interpreters in these hospitals, the social workers, and the are they called CHPs? The CHPs, at least as per now as we speak, the attitude has changed due to the continuous training that has been done by the PS Kenya through the DESIP. And then now we can also say that through training, through capacity building, and then through involvement and through including personal disability in various programs, at least we can say that PS Kenya through DESIP, we now have an increased number of persons with disability accessing the medical services.